Welcome to M&A Power in Practice, the podcast for all things M&A. This podcast is a tool for education, information, and making your collective voice heard as members of the Minnesota Nurses Association. Our 9th episode is the 2024 M&A Legislative Recap. We'll discuss what bills passed this session and what didn't, and what's next for building nurse power at the Minnesota State Capitol and beyond. Today we have joining us two of M&A's political staffers here with us to share more about this past legislative session. Welcome, you two. Why don't you each take a moment and introduce yourselves?
Hi, my name is Ben Baglio. I'm a lobbyist with the Minnesota Nurses Association. I've been at M&A since January of 2023, so for 2 legislative sessions. And as a lobbyist for M&A, I focus mostly on advocating for good public policy that advances the goals of M&A and nurses and supporting the other objectives of the organization.
Hi, my name's Jackie O'Shea. I'm the senior political organizer at Minnesota Nurses Association. I've been at M&A for almost 9 years. September will be 9 years. My role at M&A is the development and implementation of our political programming, both at the ballot box and at the Capitol. And then this past legislative session, I worked with Ben up at the Capitol, mostly in our labor policy bucket and then also in the anti-corporatization policy bucket.
Great. Well, welcome again. We're happy to have you both here and are excited to hear more about the legislative wins from this year. Why don't I pass it off to you two now to share more about what happened at the Capitol this year?
Yeah, I think there were a lot of good wins. It was a hard legislative session. It's been a hard past 2 years up at the Capitol, but we did get some wins this year, one of them being a continuation of the annual adverse health events report. I know that report has been a focus of nurses to be able to use that information and that data to pin a spotlight on hospitals who aren't doing enough to support nurses and to support patients so they can provide, better health care for folks. And, this is vital information that, nurses use to advocate at the bargaining table and at the Capitol for not just themselves, but also their patients. And so without this law, we wouldn't have been able to have this report moving forward. And the good thing is that there's no longer a sunset date on this. So this report will continue into perpetuity.
Yeah, and that's a huge way to arm us with the data at the Capitol. And another, big victory that we had here in 2024 was expanding on the student loan forgiveness for nurses law that passed originally in 2023, which was our state's first student loan forgiveness program specifically for registered nurses. So M&A did fight for additional changes to that program this year, along with trying to get more funding behind it. But what ultimately we were able to get passed was a continuation for the next 3 years. So this means MDH will be administering $5 million in loan forgiveness for hospital nurses, which is going to result in about 400 nurses receiving awards. And so that cycle for the application process at MDH opens up August 1st. And so when you're listening to this podcast, it's probably open by now. And so MDH has made some changes to that application process, which will be on their website, largely based on feedback, especially from folks like us here at M&A. And they've, done things like eliminating the essay questions that were once part of the application process. And so MDH has also updated and clarified the reference letter prompts that were once part of the application.
Yeah, and hopefully that'll make it a little bit more of an equitable process for nurses. And I know we tried to make other changes to the program this year and it didn't go far enough, but getting the additional funding is a huge first step to continuing the program further.
Yeah, and really leaves the door open for future programs like this that hopefully have an even bigger, wider scope that we can provide some relief to nurses in that way. A really big thing that we were able to get passed this year is what we were calling the closures bill, so beginning August 1st, hospitals and health systems, if they plan on closing a facility, closing a unit, reducing or relocating services to another facility, they're now going to have to do a whole lot more to notify the public, patients, workers, and the community about what their intentions are and how those services are going to be changing. And they have to do that, much further out, right? So that notice has to be provided at least 182 days before any changes take place to those services. And hospitals are going to be required to hold a public meeting within 10 miles of the impacted hospital whenever their plans trigger this new law. And then there's some really strict $20,000 fines when hospitals fail to do things like tell workers their jobs are going to be relocated. And so this bill was authored by Representative Andy Smith and Senator Rob Kupek, and really did get some bipartisan support because, most folks are feeling this pinch, not just in, the Twin Cities area where we're seeing things like mental health services just being slashed by the big health systems, but in greater Minnesota, mental health, but also labor and delivery services have just been on the chopping block, as these corporate entities feel they're not producing the revenues that they want. And so because of that, care is, getting further and further away from people. And so this legislation is going to create a lot more transparency around that process. It's going to give workers and patients a lot more notice when these changes are going to happen. And it really is going to force, with those big fines, the hospitals to act more transparently.
I think it's also an opportunity for patients and nurses in the community to also hold MDH accountable with this new process. It is an improvement of current law, has a lot more accountability steps in it. But, we know that there's always a way that employers will jump through any size loophole that they can find. So I think it's still going to be on us to be diligent in tracking what's happening, not just in hospitals, but what's happening with the agency.
Yeah, no, excellent points. So another one of our wins this session didn't come in the form of passing a bill, but it actually came in the form of getting the Legislative Audit Commission, which is an entity of the legislature that includes members from both parties and both chambers, the House and the Senate. And every year they come up with a list of topics that the OLA, the Office of the Legislative Auditor, will conduct to look into how public dollars are being spent, being allocated, or in some cases, how the return on investment for taxpayers are. And so what we were able to do is get the Legislative Audit Commission from the around 100 topics that were proposed by different legislators or interest groups or just citizens of Minnesota. And we were able to be one of the 5 topics that were selected by the Audit Commission to have that audit by the OLA conducted. And so this year, the OLA currently is conducting that audit, is looking into community benefit spending at nonprofit hospitals and how that community benefit spending is actually impacting community health outcomes, and how those expenditures really compare to the tax breaks that they receive. These big health systems get millions in tax breaks every year, the local, state, and federal levels, but there isn't much of a mechanism to see what does that return on investment for taxpayers look like. Are they really fulfilling their obligations as a so-called nonprofit organization, or are they taking more than they're providing? And so later this year, that OLA audit will come out. The OLA is a small but mighty nonpartisan organization that does a deeper dive than I think we probably could have gotten anywhere else. And so once that report comes out, I think we're going to hear a lot about the finances at some of these big hospital systems.
And correct me if I'm wrong, but I don't think the OLA has done this type of audit on hospitals in the past. MDH has done audits on charity care spending and, community benefit spending and that sort of stuff in the past, but this is a new kind of territory to be able to use the OLA as a lever to hold hospitals accountable.
Yeah, definitely. So usually the OLA, the Office of the Legislative Auditor, their audits are looking into like a specific state program or a set of similar programs. This is pretty unique, and the fact that we were able to get this across the finish line in itself is pretty unique. And so this is a different way of using the OLA, who's been in the news lately for their very thorough audits of state programs and state agencies and the way that they oversee things. And I have a feeling the OLA is going to really be looking into how does our state, and specifically the Minnesota Department of Health, actually regulate the financial spending of our hospitals who do not pay taxes. And it'll be a really telling report when it comes out.
And could be a lot of opportunities for future legislation.
Yeah, I think this is the type of data that just has not been collected, gathered, reported on anywhere at an official level in our state. And, if we're doing things right, and if the legislature will listen to M&A's continued advocacy, this is going to help inform some really serious, much-needed changes to our state healthcare infrastructure.
Yeah, and huge shout out to Representatives Emma Greenman and Rick Hansen, who sit on the OLA, for helping us get this audit. Another piece of great legislation that passed this year that we worked on was reforming our broken system around medical debt. As of January 1st, 2025, patients who experience medical debt, which includes nurses, due to our broken system, will get some relief under law. The legislature passed what's called the Debt Fairness Act and included other consumer debt protection provisions. The ones we focused on and worked on were the ones around medical debt. And so this includes reforms around wage garnishments of medical debt, finally removing spousal liability under state statute for medical debt, forbidding refusal of essential care due to medical debt, and medical debt will not be reported on credit reports. There's a lot of people in this state and in the country that carry medical debt unto no, fault of their own. It's just the broken system we're working in, whether it's costs in hospitals, costs for insurance not covering procedures, and not covering the medical care that patients need. Another small but mighty piece of legislation that passed this year is surgical smoke protections in operating rooms. So effective January 1st, 2025, all hospitals, surgical facilities, and outpatient surgical centers who perform surgeries will need to implement policies to prevent exposure to surgical smoke, which must include the use of smoke evacuation systems during any surgical procedure likely to generate surgical smoke. This bill was brought forward by other healthcare workers that approached M&A and asked us for our sign-on and help, and we testified up at the Capitol for this and helped get this included in the Labor Policy Omnibus Bill. And speaking of programs, the Earn Sick and Safe Time program that has been talked about all year long and even prior to, because M&A has been working on Earn Sick and Safe Time ordinances across the state for the better part of almost a decade now. The changes to last year's Earn Sick and Safe Time law is prohibiting employers from creating multiple sick leave pots moving forward. I'm sure some nurses have dealt with this in their facilities of these different pots of sick leave time. And so the changes in the law this year hopefully are going to alleviate and clarify what the pots of leave are. And then additionally, Earn Sick and Safe Time hours can now be used to make funeral arrangements, attend funeral services or memorials, and address financial legal matters that arise after the death of a family member. Additionally, the paid family medical leave program this year got some technical changes to it.
Yeah, I mean, the Minnesota's paid family medical leave program, which is, passed last year and is, maybe the strongest state program in the country, thanks to labor unions that got it across the finish line. Just because we got it passed in 2023, though, didn't mean that it was, a done fight. And labor unions, along with some of our other partners, fought very hard, tooth and nail, against large employers, folks like the Minnesota Chamber and others who are, quick to oppose worker rights initiatives. And so it wasn't a done deal. And up until the final weeks of session or even days of session, it felt like there was a good likelihood that 1 week of that 12 weeks of paid leave was going to be stripped from workers to figure out a way to make it easier to pay for it. And it was thanks to the work of labor unions, including M&A, that we got the governor to put his foot down and other legislative leaders to put their feet down and to prevent that week of paid leave from being stripped from workers because business interests, felt like it was in their best interest to force workers to work that extra week.
Yeah, and I think employers are going to come back and try to weaken both Earn Sick and Safe and paid family medical leave every single legislative session into perpetuity, trying to make what they say or describe as small changes that could have huge impacts on workers. And we believe fundamentally Earn Sick and Safe Time and paid family medical leave are worker rights and should be protected. I mean, another thing that passed this year was stronger protections for pregnancy and parental leaves. One of them being that employers must continue to provide health care coverage for employees and their dependents when they go out on their protected 12-week parental leave. That 12-week protected leave was passed last year's legislative session. So then employers came in and found other ways to, be frank, screw over workers by trying to deny them health care access during that protected leave. And it also forbids the employer from shifting the full cost of the healthcare benefits onto the employees during that 12-week paid leave. We have heard numerous times of hospitals and other employers trying to put people who are on paid leaves on COBRA, if they were going to be gone for more than a short period of time. So we continuously have to come back each legislative session and make sure we are protecting these fundamental rights that workers should have and access to time to care for themselves and their families.
Yeah, and speaking of things that M&A has worked on quite a bit, to kind of round out our list of some of the wins that we're going to talk about here this session, a number of health maintenance organization or HMO regulations were passed this session, and M&A was one of the few organizations that were really leading the charge on getting those across the finish line for a number of years, really. But the success this session, was kind of a culmination of a lot of that work. And so M&A and others were advocating for, prohibitions on nonprofit HMO organizations converting to for-profit organizations. And we didn't get the outright ban that we wanted, but we did get some really significant regulations that are going to curb or even effectively make those types of conversions impossible, hopefully for many of these organizations. And then there was an outright ban on state agencies contracting with for-profit HMOs to provide services to to state workers. And so as you can imagine, when we're doing something like this, we're taking on the insurance industry, and that's not an easy lift. But the fact that these got across the finish line this year was pretty incredible. Incredible work that'll hopefully help us shift the healthcare industry here in Minnesota, and just taking those profit incentives out of the picture is one of the most important things that we can do for healthcare.
It was a huge thing to get across the table, even though it wasn't the full victory that we were seeking. I mean, look how much money health insurance companies have. Can you imagine the influence that they have up at the Capitol, the number of people they can hire to go lobby, the unlimited funds they can use for targeted ads and other pressure points against elected officials? And it really took the advocacy of, labor unions, progressive organizations, and patients in Minnesota to get that change.
It was a huge group effort, and wouldn't have gotten across the finish line without it. And, we work in coalition with a lot of folks and a lot of other organizations throughout session. Some things really are, M&A bills that we're pushing for, but we don't try to do anything alone. And the more folks that we have fighting with us, the better our chances typically are, right? And so kind of an example of that is we're moving on to things that didn't pass this session, but that we put a lot of time and energy and work into, both members and staff. The first would be the Healthcare Employee Anti-Retaliation in Labor Act, or the HEAL Act, which would have allowed nurses to refuse an unsafe assignment by providing nurses with protections from retaliation under labor law. So, under existing law, nurses have that ability to do so and refuse that unsafe assignment, but there's no protections. And so the goal of the HEAL Act was to beef up those protections for workers who are thinking about patients and putting patients first and saying this assignment is not safe. This isn't okay for anyone involved. And we know retaliation happens. This bill was, while it was an M&A-led bill, this was a labor coalition that was behind this bill of unions that represent healthcare workers, not just nurses. And, these were the types of protections we were looking for. Another piece of legislation that was a priority bill for M&A this session was the Improving Safety in Hospitals Act, which was M&A's workplace violence prevention bill, which was centered in trauma and informed care, but it didn't pass despite pretty clear consensus and acknowledgement from legislators on both sides of the aisle that workplace violence in hospitals is a problem that needs to be addressed. Getting legislators to hone in on what the solution is and how, that solution can be rooted in trauma-informed care proved to be a little bit of the sticking point this session. And you could say this about all of our issues and the bills that we push forward at the Capitol, but I'm not sure if there's a bill more than this one or, our efforts in the past around violence prevention that hearing directly from nurses could ever be more vital to a legislator to understand the problem, because they can hear from someone like me who's a paid lobbyist or someone else on staff. And a lot of folks, at the legislature, they'll listen to us when we raise these things, but there are some legislators who need to hear those things firsthand from nurses. And I've witnessed it this session is we're talking about workplace violence. I've witnessed nurses sharing their own story and moving legislators because, that really is what gets them to see the problem for what it is and not what the hospital administrators are saying it is.
Mm-hmm. Another piece of legislation that was vital, not just for M&A, but for the labor movement that did not pass was unemployment for striking workers. This was a really hard conversation to have up at the Capitol because, once again, it's workers versus their employers. A lot of school districts, local governments were coming out pretty hard against this bill. And because we did not have 34 votes in the Senate, the bill did not get a final vote in either chamber. And this is definitely something that labor is going to keep working on and working towards. We know that nurses, who about 15,000 of you are about to go in front of your employers next year and bargain, know that your employers will spend tens of millions of dollars to break the union, and that unemployment during a strike would be a tool in the toolbox needed to help even a little bit balance, the dynamics, the power dynamics between workers and nurses in particular in hospitals, even though that would be just a small piece of the puzzle, right, Ben?
Yeah, and I'll just tell you, I had conversations with legislators on both sides of the aisle this last session in both chambers on this topic, and there were folks in both sides of the aisle in both chambers who I think there was a bit of a disconnect in them really understanding that when nurses and other workers strike, it's not because they want to, it's because they have to.
Yep.
And because they have to, that's the justification for eligibility. They have to. There's 2 states in the country that have this, New York and New Jersey. It's not abused there. You can look at the numbers. It doesn't cost the state that much money. It actually predates unemployment insurance without eligibility for striking workers. The first UI program in the country was in the state of New York under Governor Franklin D. Roosevelt, and it included eligibility for striking workers. So striking workers, just like folks that were laid off or otherwise unemployed through no fault of their own, they were eligible just like anyone else. And it was, of course, big business at the federal level that prevented that, the railroads from happening nationally. This is proven. It's been done, and been done well, and it helps workers, and it doesn't come anywhere near to completely leveling the playing field, but it gives workers more leverage. And, I think that's what legislators on both sides of the aisle, including those that have the L at the end of their party, need to better understand, is that workers don't choose to strike, they're forced to strike.
Right. And nobody wants to go out on strike ever for themselves or their families and only get 65% wage replacement. When you have kids in daycare, you have student loans to pay. It's not a lucrative option just so you can't work. So there's a lot of myths out there about how workers determine to go on strike and what it's like to be on strike. And so we need to get more nurses and other workers who've been on strike to in front of legislators, talk about how they came to that decision. And hopefully that will help inform the argument and beat back some of the anti-worker narrative that happened up at the Capitol. Like Ben said, Republicans and Democrats were repeating, and it was very frustrating.
Speaking of strikes, one of the favorite tools of strike-breaking corporations, the Nurse Compact, was introduced this year.
Yeah, there was a last-minute effort in the Senate to make Minnesota a Nurse Compact state, and luckily it did not pass. And, the compact has come up a lot in the past couple years related to the workforce shortage issues in healthcare. But we know corporate greed is using the compact as the solution or the idea to the solution of the workforce crisis, even though no Nurse Compact state has seen improvements in, open positions in nursing or anything else to prove that argument at all. It's a false narrative. It's a false solution to the workforce shortage crisis when we should be focusing on conversations around recruitment and retention of nurses. Every single state in the country has a workforce shortage in healthcare. Minnesota's not special.
Yeah, I'm not quite sure what pool they think they're going to be drawing from.
No.
Apparently the same pool the hospital executives in other states.
Right. And in fact, vacancy rates in nurse compact states have historically been higher than in non-compact states. And there's a reason for that, whether it's that state has unionization or not, what they pay, the accommodations inside hospital, the staffing levels inside hospitals. So, I mean, this is in addition to all the other concerns that nurses have raised about the compact in the past. But right now, the conversation at the Capitol is around workforce solutions and healthcare. So it's more than just, education standards and, that sort of thing. It's about protecting patients and dispelling the myths about what the compact does.
Yeah, and I think it really just feeds into the larger narrative, right? Like, we know there are workforce issues in healthcare. Like, we're well aware of that, and in nursing specifically. But it's a total smokescreen that the hospitals and their lobbyists are throwing out there. They think they're acting like the nurse licensure compact is going to solve it, or making it easier to bring in, travel nurses during strikes for a longer period of time, like they tried getting past this session. Like, they're doing a number of things. They're often griping about the Board of Nursing and how long it takes for licenses to be issued to nurses. And I'm not going to, spend the time carrying water for the Board of Nursing or necessarily speak to the amount of time it takes an applicant who's applied for a nursing license to get their license from the Board of Nursing, although funding was passed last year to make those things better. It really just feeds into the larger smokescreen where they don't want to take accountability for their lack of focus on retention and keeping nurses and other healthcare workers in their jobs at the bedside, and instead prioritizing this churn and burn recruitment first approach that every major hospital HR department is deploying right now.
Exactly.
Well, thank you for all of that wonderful information and conversation over what passed and what didn't this year. I'm wondering if you can tell us more about what's next. What do you foresee coming up this next legislative session? Anything coming back to the Capitol? We also have the elections coming up this fall. How does that integrate into our legislative program here at M&A?
Yeah, a lot of good questions and related questions there on that. So when it comes to where things are going to go moving forward, obviously a ton is going to be determined by what happens in the election this November, both here at the state level and, are there going to be pro-nurse majorities in the House and in the Senate here in Minnesota? And, that certainly dictates what we're going to be able to do. But then there's a number of things where, there's ongoing work that's been done by M&A to keep discussions going or progress being made in certain areas. I think for us and for others working in the healthcare space, it's really trying to help legislators, connect the dots between our fight and that broader fight against the corporatization of healthcare. And, at the end of last session, we got some victories, in this area, but we didn't get everything done, right? And so at the end of last session, we actually tried passing a law that would have required hospitals to go through a mandatory public interest review if they wanted to close a unit, close a hospital, or just reduce or relocate services, right? And not only were we trying, to be blunt about it, we were trying to stop the closures and consolidation at Unity, Mercy, and North Memorial, but we're also trying to stop future consolidation too, where we see these big health systems stripping services from community hospitals across the state. And, we made it further with that effort than we thought we could or would. We had an amendment pass on the floor of the Senate with bipartisan support that added it to the Health and Human Services Omnibus bill, and then it was removed in committee. And both chairs of the health committees in the House and the Senate, Chair Representative Tina Liebling and Chair and Senator Melissa Wickland, have said that they'd be interested in pursuing this topic again next year and figuring out what mechanism at the state level can we actually put into place to start regulating hospitals and hold them accountable for the fact that they're stripping services from communities across the state without any regard to what patients need, what communities need, how much money that community's invested into that hospital, or the impacts to workers.
Yeah, and I think to even go further, hospitals and their financial reporting and or lack thereof, their hospital reporting forms are not transparent. Their finances aren't as transparent as they should be. And I'm starting to believe more and more and more as I work year after year here at M&A, and I'm hearing what the hospitals are saying at the Capitol. I'm hearing how elected officials are responding to that we need more transparency in their finances as part of our fight for staffing in hospitals. Hospitals get to go out there, their executives get to go out into the community and say, well, if this staffing proposal passes, we're going to have to close this hospital. Our finances are too tight. We can't do more of this, that, or the other thing. Where's the proof of that? Where's the public proof of that? And so I feel like we need to, as we continually fight for staffing at the Capitol, which of course we will next session and every session until we pass something, I think we need also some more transparency and accountability around hospital financing to help beef up our argument, or at least expose the hospitals for what they are.
Yeah, I mean, the fact is, as it stands currently, we don't even know the types of money that the hospitals are throwing at anti-union, anti-labor, union busting lawyer firms. We don't even know how much it is.
Yep. Despite
the fact that these are publicly funded, most of their revenue comes from public dollars at the state, local, and federal levels, and yet we have no transparency into their books. And so the playing field, it's never going to be level if we don't even know what they're throwing at us, right?
Exactly. And I think, the fight against corporations, against corporate healthcare, it's connected to our fight for staffing, for workplace violence prevention, around closures, around public health, around UI for striking workers. It's all connected to the stakes of this year's election that will determine the electorate up at the Capitol. This year we have the Minnesota House is on the ballot, so all 134 districts have an election. We also have a special election in the Senate for one seat in Senate District 45 because Kelly Morrison resigned to go. She's running for Congress in Congressional District 3. So we have an opportunity there with retirements in the House, retirements in the Senate to help elect a nurse a champion majority for nurses in both chambers. We have had clear struggles with key Democrats in both chambers, and some of those folks aren't running again. And so we have a real opportunity to do that work this year, but it's going to take not just voting, but talking to fellow nurses about endorsed candidates. It's going to be about engaging in your community and talking to your community members about who's on your ballot and why you're supporting them, because it's all connected to the nurses' fight for improved working conditions in hospitals so you can give better patient care.
And as Jackie said, nurses year after year are voted on by Americans as the most trusted profession. Mm-hmm. And so when legislators and your neighbors hear from nurses, it just carries so much more weight than when other folks are even saying the same things. And no one's better positioned to lead the charge to fix our healthcare system here in our state than nurses.
And one thing nurses, M&A has been working on and saying for a long time is we want to co-govern with elected officials. Nurses want to be part of governance. They want to co-govern. That includes relationship building and accountability, and showing up and being present and being seen by elected officials. That's one step of the accountability, to be able to tell them, we're watching you, we're paying attention. Let's have a conversation about healthcare. Let's have a conversation about hospitals. Let's have a conversation about our upcoming contract fights. We have to continuously be having those conversations. And, this year, M&A will be engaging in the elections like we do every single year, not just as a union, but also as a labor movement. M&A, nurses have been actively all summer screening and endorsing candidates in districts across the state. You can find those endorsed candidates on the M&A website right now. And moving, closer to Labor Day, will actively be calling nurses in those endorsed candidate districts, talking to them about not just the elections, but also what is happening in your hospital, what is happening with you in your daily life, connecting that back to the values of and the vision of who nurses have decided to endorse in this election. And it's about passing policy. Elections is a tactic and a strategy to pass policy up at the Capitol. And additionally, nurses will be out there in the labor movement with the AFL-CIO, doing door knocks with them, standing shoulder to shoulder with all labor unions across the state to get labor champions elected to the Capitol as well.
And without more legislators, not just supportive, but willing to champion M&As and nurses' issues, like things like safe staffing and actually addressing workplace violence in hospitals, those things just like won't happen. And so really getting front and center is just so important. And if we can change the dynamics of the legislature, we can really, really make some things happen next year in St. Paul.
For nearly 2 decades, I think, someone can correct me if I'm wrong, staffing has been the number one priority for nurses, either in contracts or up at the Capitol. And if we want to seize on that opportunity to pass staffing, we came really close last year. But if we want to seize the opportunity of this year's elections, like we have to jump in on it. Like you have to really want it. And if you really want it, it's time to, educate, agitate, and organize yourself, your coworkers to actually show up, not just at the ballot box, but also next session to hold these elected officials who get elected this fall accountable.
Yeah, thanks for sharing that. Now, I'm wondering if you could also talk a little bit, I know you already mentioned some of these things already, but how can nurses get more involved in our political program, our legislative program moving forward?
Yeah, I'll talk about elections first, since that's front of mind. Then we'll pivot to legislative session. Nurses have about wrapped up screenings for this year, which means we're going to be pivoting into programming. That's organizing. So it's phone banking and door knocking with fellow nurses and with fellow union members. There's going to be opportunities on the M&A website, but also you may get an email, a text message, or a phone call asking you to show up, whether it's for a phone bank, whether it's for a community event, for an endorsed candidate, or it's to help door knock labor households with other labor unions here in the near future. You can also proactively reach out to us at the M&A office. You can reach out to me or anyone in the political organizing department to get plugged in ASAP. Part of doing this work isn't just asking someone, hey, will you vote for X? It's about sharing your story. It's about sharing what's happening to you in your facilities, and not just with fellow nurses, but also with the community. Elections are also an opportunity for nurses to go out and talk to community members about what's happening in your community hospital, which is vitally important to, get more public support for our issues up at the Capitol.
Yeah, and that's right. So like after nurses help change the course of the election this November, the work at the Capitol starts in January in St. Paul, where, nurses can come with staff and we'll meet with legislators one-on-one, right, to help you talk to your legislator about why it's important that they think about things from the nurse perspective. Bills that move through the legislative process get a lot of hearings in different committees, and so having nurses there, either there and in red in the crowd to be seen, because legislators definitely see that and they know what it means when M&A is somewhere because they see it, or testifying on a particular bill in a legislative hearing to give that nurse perspective. And that's something that nurses are really, really great at. And I've seen them move a lot of legislators by tugging at the heartstrings with their own stories about their work experience. And so those are some of the ways that a lot of nurses get involved, but also throughout the course of the legislative session, a lot of nurses will reach out to their legislators via email to urge them to support a particular bill. And M&A does a lot of work through our political organizing to make that even easier. You can kind of do those at just a click of a few buttons to send those emails to your own legislator, or to do our patch through phone banks where, maybe a particular legislator needs to hear from nurses about why a bill matters. Maybe they've been hearing a little bit too much from hospital lobbyists. And so, we can set that up where, nurses can get patched through to talk directly to their legislator. And again, those things really, really do matter. I have had horrible conversations with members of the legislature where I thought they were going to vote against us. And then hearing from 20 nurses about why they're wrong totally flipped it. And they were with us. And so it does work, and it's totally not just effective, but so important.
Well, and one of the reasons why it's really effective is because, Ben and I may not be a constituent in their district, so we can't vote them in or out of office, but you can. And another thing too, if you are interested or want to get more involved, we're happy to have one-on-ones with folks, right? So we can answer any questions you have, hear your ideas for engagement. If you want to actually meet with your legislators at any time, like, we can help facilitate that. We do an in-district meeting program. We do Day on the Hill every single year, where that's our largest advocacy event. And so there's a lot of things that are going to be coming up in the near future. I mean, it's August when we're recording this. So it's going to be legislative session before you know it, which starts, I believe, January 14th. So it's really right around the corner.
Yeah, and I know there's also, the Governmental Affairs Commission as well,
Yep.
that members can get involved in pretty much at any time, or can go to them to ask questions or share ideas about what they think some good upcoming legislative ideas or electoral programming ideas could be. So it's always another great avenue to get involved.
GAC is also going to be discussing soon and putting out a legislative survey to all members, which is also going to be an opportunity for nurses from all across the state, a lot of them who can't make it down to the Capitol, to do stuff in person or to have a one-on-one with other nurses down here in the metro, to be able to express, their ideas of what policy should look like up at the Capitol and what we should be fighting for, and also to share their stories.
And that's such a great way for nurses to give their input on this, the public policy and political work that we're doing, particularly to the Government Affairs Commission, to GAC, because GAC really is the one that, helps us set the tone and the vision and things going into the legislative session, obviously along with other members and the board. But just such a great way for members to be heard and to really help our organization set the agenda for next year.
And I'll also just say one more thing in terms of, building our political power. It's not just up at the Capitol, it's not just in the ballot box, but it's also in the work site. And so a lot of the issues connected to your workplace also have legislative solutions. They have contractual solutions and legislative solutions. And being involved in politics as part of union affinity, it is a critical part of, building political power for every labor union in the state and every worker, being engaged in every area that your hospitals are engaged in, because they participate at the Capitol. They dump money into lobbying. They also dump money into elections. And so everywhere the hospitals are at, and MHA and the Minnesota Business Partnership and the Chamber are at, like, workers need to be at as well.
The interconnectedness becomes so clear, right?
Yeah.
When, between the political electoral work, the legislative work, and then the work in your facilities and in your units. And when you think about, especially if you're a nurse who's going to be going into bargaining next year, and you're used to your employer showing up not in good faith and not ready to negotiate in good faith, just think what something like unemployment insurance for striking workers might mean when your employer knows that if they drag this out and it escalates to that level, that, like, they're not going to be able to just bring in
they're not going to be able to starve them out.
Yeah, I mean, that's just such an extra tool for nurses in the event of a strike, that, if we can get it done electorally and then at the legislature, might help us get it done at the bargaining table even more too.
Sounds like there's been a lot of good work happening. Sounds like there's a lot of good work to come, and a lot of opportunities for our members, our nurses, to get involved. I want to thank both of you again for joining us on M&A's Power and Practice podcast. And M&A members, be sure to check the M&A website or nursescarenursesvote.com to learn more about our upcoming electoral program, our upcoming legislative program. And we'll see you next time. Thanks for listening to M&A Power and Practice. Be sure to subscribe to the podcast through your favorite streaming service so you don't miss a single episode. Want to get in touch? Email power.practice@mnnurses.org for more information.